Good afternoon. Could I have your attention, please? Good afternoon, everyone. Thank you very much for coming to this session on planetary health. My name is Andy Haynes, and I'm going to be the chair this afternoon. And it's a great pleasure for me to introduce our illustrious panel in a few minutes. But I wanted to start out by saying a few words about the concept of planetary health and giving you an overview of the findings of the Lancet Rockefeller Commission that's made its report last year. That report is available in the public domain on the Lancet and the Rockefeller Foundation websites. And there are three commissioners here today. Montira Pongsiri, Tony Capon and Sam Myers were all involved in the Commission report. So the background to the Commission is that it was funded by the Rockefeller Foundation. It was under the aegis or the inception of the Lancet, Richard Horton, the editor, who was very much instrumental in launching the concept of planetary health. So what is meant by planetary health and why is it important? Well, put very simply, it's the health of human civilization and the state of the natural systems on which human civilization and our health ultimately depends. And that's rather different to the average definition of global health, which really treats health in isolation, without asking the difficult question of whether health can really be sustainable in the future. What we have seen is a dramatic improvement in human health and welfare over the last few decades, I would say. So we've seen perhaps a 20-year increase in life expectancy, dramatic declines in infant mortality, improvements in maternal mortality, and reductions in absolute poverty. So the number of people living on less than $1.25 a day has declined very dramatically. It's under 1 billion people. Of course, there are still very big inequalities within countries and between countries, and in some cases those are increasing. So it's a very mixed picture. But overall, humanity has gone through a profound many profound advances in recent decades. But the question then we're going to discuss this afternoon is to what extent those advances could be threatened by the many changes occurring in the global environment. So what are these changes? Well, this slide just summarises many of them. There's been a dramatic decline in tropical forests, which has been accompanied by one of the driving forces that's driving the decline in biodiversity. And you can see that since the middle of the 19th century, there's been a dramatic decline compared with the pre-industrial baseline. Water shortages. Many more people over the recent decades are living in regions where there's variable degrees of water shortages. And water, of course, is essential for agriculture and for industry. Our oceans are acidifying because carbon dioxide is dissolving at an unprecedented rate in our oceans, and we still don't fully understand the impact on marine ecosystems, but undoubtedly they are undergoing radical changes. And I think we'll hear a bit more about the implications for human health of changes in the oceans later on. The most obvious change, I suppose, is climate change. That's the one that gets the most publicity. It's probably the most important for human health. It's certainly the one that we understand most about, although there are still some uncertainties. And we know that the temperature's gone up by about 1 degree since pre-industrial times, and despite the political advance in Paris, we saw an important agreement there, still the emissions under that agreement are still likely to take us to 2.7 or 3 degrees warming by the end of the century. So even if we implement that agreement, there'll still be very, very major challenges for humanity. And of course, as I say, we're losing biodiversity at an unprecedented rate, perhaps 100-fold greater than pre-human times. So one of the concepts that's been put forward to try to measure the aggregate impact of humanity on our environment is the ecological footprint, which essentially measures how fast we consume resources and generate waste, and the capacity of the Earth to absorb that waste and to generate those essential resources. And the bottom part of the slide just shows you how our global ecological footprint relates to the amount of land we actually have available for humanity to exploit And what you can see is that many of the societies in which we live, particularly the industrialized societies, are really exploiting the environment at a completely unsustainable rate. So we need about 5 planets in order to, if everyone in the world lived the same way as people do in North America, and about 3 planets if they lived the same way as everyone does in Western Europe. So we're vastly overexploiting. And although the Asia-Pacific region and Africa are currently slightly under that bar, of course populations, particularly in Africa, are increasing very dramatically, and people have aspirations to live, in many cases, a Western high-consumption lifestyle. So all of this suggests unprecedented pressures on the global environment, but also profound inequities and an inequality and inequity between those societies and those development pathways that have caused much of the environmental damage, and of course the populations that are likely to be the most vulnerable, which in many cases are likely to be the poorer populations. So what's sort of the implications for health? And I would say that one of the phrases that I think is become currency in the media is the Anthropocene epoch. So we're now living in a geological epoch which is characterized by the dominance of one species. That's our species, Homo sapiens, and that species is having these profound impacts on our environment. So the question is, what will global health look like in the Anthropocene epoch? And I think we, in the public health and medical communities, have not fully engaged with this, probably the most pressing policy issue of our time. So one of the major challenges will be the effects of multiple environmental changes on food availability and quality, and I think we'll hear a bit more about that from Sam Myers later on. So there are multiple pressures on the food system. We're losing soil through soil erosion and land degradation. Many parts of the world are undergoing water scarcity. For example, the Arab world has depleted its aquifers by over 70%. And these aquifers cannot be replenished on human life scales. We're losing pollinators, and many of our crops are dependent on bees, other pollinators. Overfishing, about 90% of the world's fisheries are fully or over-exploited already. And of course, climate change poses multiple challenges to agricultural productivity. This slide just summarises some of the effects on crop yields due to climate change, and it shows you that many studies now project adverse impacts due to climate change. This is from a 3-degree warmer world, and you can see that many parts of the world are likely to suffer from substantial declines in yields by mid-century as a result of climate change. We may see increases in some temperate regions, but the sustainability of those increases is currently unclear. So quite major challenges then in terms of food production at a time when the population and the demands for food are increasing. And this slide, taken from a science article some years ago, the blue line shows you the historical trend of increase in food production, crop yield, particularly cereal production, and the hatch line shows you how we need to increase our cereal grain production in order to meet these growing demands from a growing world population, growing demands for animal products and so on. So it's the combination of unprecedented increase in demand at the same time as increasing pressures on the world food system. But we're also suffering problems today as a result of many of the driving forces that are driving global environmental change, and amongst those, the biggest public health problems of our age are, of course, air pollution. Overall, ambient air pollution is going up in many parts of the world, and if we look in total, about 7 million deaths. These summarise the World Health Organization statistics. You can't just add the two together because there is some overlap between them, but overall probably about 7 million deaths due to air pollution exposure, both in the household, due to the burning of solid waste, solid biomass, some cases coal, and of course in our cities in particular, due to the burning of fossil fuels for energy and also for transport, of course. So what's often left out of the equation is that air pollution is a major cause of non-communicable diseases. So it causes heart attacks and strokes and to some extent cancer, and yet it's often left out of many of the strategies to tackle NCDs. But there are other changes occurring as well, which also have big impacts on non-communicable diseases. This is just one example from some of my colleagues working in Bangladesh, Pauline Shielbeek and others. And they've done a series of studies looking at the health effects of saltwater intrusion in coastal Bangladesh. So in coastal populations, in the case of Bangladesh, over 40 million people are living in areas where the fresh water supply is being contaminated by salt water as a result of sea level rise due to a variety of environmental changes. And what they're finding in this environment is that there's an unusually high incidence of preeclampsia and hypertension, and that is the relationship between that and the amount of salt that people take in their drinking water. And so this suggests another way in which environmental change can affect non-communicable disease risk, and one which, as yet, we don't have an easy answer to. We also know that environmental change affects many infectious diseases, and this slide just summarises some of the drivers of recently emerging infectious diseases in humans from wildlife, and it's a great pity that the One Health session is going on simultaneously with this one, because they'll be talking about some of these issues in more detail. But just to give you a few headline messages, you can see that many of them are related to land use change, much of that, of course, in our quest for more food, changes in food processing, agricultural industry changes, war and famine, and of course climate and weather also playing a role as well. So environmental change, changes in demands for food and other products are some of the important driving forces for some of these recently emerging infectious diseases. And then we have growing emerging evidence base about environmental change and conflict and population movement. This is just one paper by Siang and colleagues in Science a few years ago, where they did a meta-analysis of studies since 1950, and they showed that for different types of violence, whether it be local violence in East Africa, civil war in sub-Saharan Africa, civil conflict onset in the global tropics, that there were complex but fairly consistent relationships between temperature and the probability of different types of violent conflict. And so that's quite a seminal paper. It did spark quite a debate in the literature, but I think it certainly provides a suggestion that environmental change may well affect the risk of conflict. So the Planetary Health Commission also illuminated a number of potential solutions and remedies to these interrelated problems of planetary health. And I don't have time to go into them in detail. Some of the speakers later on will talk about them. But I do want to just leave you with a few headlines. One is that the future will depend very much on cities, because, of course, all the population growth we're going to see in coming decades will be in cities. Many of the smaller cities in low and middle income countries, which are rapidly growing, do offer real opportunities to develop cities that are laid out and configured in different ways to current cities, and hopefully will learn many of the lessons from the mistakes in urban planning that have been perpetrated over recent decades. Cities are the engines of economic growth. They're responsible for the majority of energy-related greenhouse gas emissions. And this slide also reminds us of the difference between different cities, even at the same level of development. So, for example, on the left here we have Atlanta, which is a very sprawling city with an urban area of over 4,000 square kilometres, a population of just over 5 million. And on the right, Barcelona, similar population, much smaller land area, about 160 square kilometres, and 1/10 of the carbon emissions from transport. So a much smaller environmental footprint, at least from transport, in the case of Barcelona compared with Atlanta. And so that gives us a clue that maybe we can learn from some of these natural experiments to develop cities which are more compact, much lower environmental impacts, and much more health promoting through low carbon and active travel policies. We must also remember that nature itself can support health directly, and this slide just illustrates again a meta-analysis of studies looking at psychological and emotional outcomes from exposure to natural versus synthetic environments. And the vertical line is kind of no effect. On the left you can see that many of the studies show that you can get an improvement in displeasurable moods as a result of exposure to natural environments. And again, that gives us a clue of the kind of cities we need to develop in the future, with access to secure green space, which can also protect biodiversity, reduce the urban heat island effect. And there are other examples too, which I don't have time to go into, of how supporting ecosystems can also help to improve human health. So cities can help to support planetary health by providing universal access to clean energy, improving water and sanitation access, safe access to green spaces and ecosystem strategies for resilience, and of course providing accessible and efficient public transport and active travel. We also know that food systems, which Sam will be talking about, have a major effect on the environment. They're responsible for about 30% of greenhouse gas emissions, but we also know they're very wasteful. About 30% of the world's total agricultural land is used to produce food that's never eaten. So reducing food waste, a major strategy to improve food security and tackle planetary health. We also know there's big differences in environmental footprint of different types of food, whether that be land use, greenhouse gas emissions or water use. And this slide, taken from one of my colleagues, Hannah Tuomisto, just compares the greenhouse gas emissions per gram of protein for different types of food. You can see beef and sheep are particularly high because they're ruminants, but it does depend on how you feed them. In general, vegetables like pulses are much more efficient. And there's a little box at the far right which raises an interesting issue, which is cultured meat, which is where they grow meat in laboratory facilities. It's still under experimental assessment, but the early assessment is that it probably would result in a lower environmental footprint. So for discussion, is that the way we should go or not? Or should we be promoting a vegetarian diet? Interesting point, discussion point. What is very clear, I think, is that we can't persevere. With a population of 10 billion people, they can't all be eating the same diet as people in the West do. And of course, we're feeding a lot of our grain to animals. We're not eating it and consuming it directly. We also showed that there are many taxes and subsidies that are pushing us in the wrong direction. So there's $5 trillion of energy subsidies going to fossil fuel industries and much less going to renewables. And there are subsidies in the agriculture and other sectors that are pushing us in the wrong direction completely. So we need to rebalance the tax system to reflect the full economic costs, so-called externalities, of these industrial activities. And I think the private sector in the future, and I think Dr. Seebach will be talking about that, I think successful private sector will be that recognises very early that there are major rewards to be had by getting very early into this agenda and creating new business models which promote rather than undermining planetary health. And then finally, a major policy opportunity, which I think Montira Pongsiri will be talking about, is the Sustainable Development Goals, which, of course, only one of them is directly about health, but many of them are indirectly about health. And if you look at them in totality, they actually represent many of the issues that I've talked about. And the indicators for the Sustainable Development Goals will provide a very useful framework for measuring and monitoring progress towards planetary health. So that is a major opportunity that we need to capitalise on. So I will stop there, and I will, the way we're going to do it, I think, is just to take points of clarification after the talks, and then we're going to throw it open at the end to a much more general discussion. So the first panellist will be Tony Capon. Tony, I know, has to go on to another session after this, so he's not going to stop, so I will take questions to him immediately after his presentation, and indeed, if there's any points of clarification to me, we'll take them then. Tony is the director of the Institute of Global Health at the United Nations University in Kuala Lumpur. He's shortly moving to the University of Sydney, and he's going to talk about urbanisation and planetary health.
Well, thanks very much for that introduction, Andy. And very appropriately today, we had Meatless Monday here at the World Health Summit. And so I think that I've certainly enjoyed the meatless food today. Now, perhaps in years to come, as Andy said, we might have cultured meat, but let's wait and see about that. So I'm going to offer some reflections building on what Andy said about how we might think about urbanisation and health if we look at it from a planetary health perspective. So importantly, we need to remind ourselves of the demography here. So population of the world in billions, projected from 1950 through to 2030. And you can see here the purple bars, the seemingly inexorable rise in global population through this period. Importantly though, we've got the two lines here. We've got the blue line, which is the proportion of people living in cities, and in the countryside, and the red line, the proportion of people living in the cities of the world. And I find it quite useful to think about this graphic from the point of view of my own lifetime. I was born in 1960 on a farm in the very south of New Zealand. And so at that stage, there was 3 billion people in the world, and 2 billion, or 2/3, were living in the countryside like me in New Zealand. But here we are at this point. We've just passed the point where now more people in the world live in cities than in the countryside. And from my point of view, if I die over here, hopefully off the chart, if I take on some of the advice here at the World Health Summit, then I'm likely to die in a large city, because as Andy pointed out, most of my life has been in the city of Sydney, in Australia. And by that point, 2/3 of the people in the world will live in the cities. And notably, during that period, the population living in the countryside will only have grown by 50%, from 2 billion to 3 billion, but the populations living in cities will have grown by 500%, from 1 billion to about 5 or 6 billion. So I guess the message here is that this is an extraordinary challenge for us all, because in the coming decades, the next few decades, as we're thinking about these SDGs that Andy mentioned, we'll be adding 2 or 3 billion people to the populations of the cities of the world. And when you do the math, that's more than 1 million people every week. Now, how will we live, how will we shape those cities, and what will be the impact, the ecological impact of those cities on our planet? That's the big challenge. And as I said, a big opportunity for us all here at the World Health Summit. Important to remember history too, of course. Here at a largely medical summit, we should remind ourselves of Hippocrates, arguably the father of medicine. And all these years ago in Greece, one of his treatises was about these links between health and environment on airs, waters and places. And the Romans, of course, thought carefully about the way they designed and developed cities in the interests of health, providing public baths, aqueducts as seen here to bring clean water into the cities, draining marshlands to prevent exposure to mosquito-borne infections. And another way of thinking about this history, this historical view of urban health penalties, here from a developed country perspective, a graphic prepared by our eminent colleague Tony McMichael. And here what Tony's done on the vertical side there, the indicative health risk through the phases from the 1800s, the phase of industrialization, through modernization last century, globalization where we are now, to what might be ahead. And in many ways, we've made progress from a health point of view. We've tackled many of the great infectious diseases in these developed environments, but you can see there from Tony's graphic, we're concerned now about re-emergence of infectious diseases. We've tackled air pollution in some parts of the world, road trauma through engineering interventions, behavioural interventions. But we now face new challenges. The challenge of the obesity epidemic globally, NCDs, rising greenhouse gas emissions, as Andy pointed out, and clearly this is not sustainable. This is a picture from the Australian Academy of Science, which is one of the members of the Inter-Academy Partnership for Health, a great contributor to this meeting. a conference that we convened in Sydney about 10 years ago on urbanism, environment and health. Urbanism, the way we live in cities, the consequences for our environment and for our health. And Tony McMichael is there in the front row. Now, this was also one of Tony's slides that he showed at the introduction to that meeting, a graphic about transport systems and health. And you can see it's a very busy slide. There's a lot going on here from a health point of view. And so that's the key message that I want you to take away when we're thinking about the relationship between urban transport systems and health. But a few words about this graphic. You can see there on the left the transport system that we have in a city like Berlin here today reflects the history of the place, is partly inherited, but importantly, it evolves over time. We can see the development of new mass transit infrastructure here just outside the building. It's partly planned, and it reflects our values, preferences, and theories of the city. Notably, though, the transport system will have consequences for energy needs and use, the mix of modes, the associated infrastructure, how much space all this takes up in the city, and a range of what we might call determinants of health. Air pollution exposure, greenhouse gas emissions through different timescales, of course, but noise, exposure, our ability to move in an active way, so important for our physical and mental health and well-being, with feedbacks on the space available to green the city. So in red there, a range of potential impacts on human health. At that conference, one of the things that came from it was this framework for thinking about sustainability and population health from an urban perspective. So just to walk you briefly through this, the grid on the top axis, we divided what constitutes a city into 6 broad domains: the economy and work, the transport and urban form, the housing and buildings in the city, the nature and landscape opportunities, media and communication, and cultural and spiritual dimensions. Now, these 6 domains of the city sometimes end up becoming planning and management stovepipes in urban government, and clearly that can create challenges for sustainably managing cities, because cities are systems, and when they're operating on a daily basis, they have a footprint on the planet. Andy referred to this ecological footprint before. Now, on the vertical side there of this graphic are what we in public health call determinants of health. The air we're breathing, the water we're drinking, the noise exposures, infection, allergens, chemical exposures, local climatic conditions, food security, physical activity, safety, family relationships, and social capital. And in aggregate, these determinants will shape our health and well-being, both physically, mentally, and personally and collectively. The point of this grid is that in those cells in the middle, we can ask important research questions, policy questions, urban planning questions to wrestle with the trade-offs that are taken in relation to decision-making every day by city managers. A few words about systems thinking as I wrap this part up. This has already come up yesterday strongly in some of the discussion that we had in a workshop about planetary health education. The importance of systems thinking when we're grappling with these big challenges. And several reasons why that's useful. Because it enables us to understand the dynamic interactions across sectors in this city context, for example, the concept of feedback, policy resistance, why we seem to be stuck around many of these issues, and then where are the leverage points, where are the opportunities for change, and notably the unintended consequences from the sorts of things we might do. And I guess that brings us back to Hippocrates with first do no harm in our interventions. A couple of examples of system problems in this context. So when we're thinking about unintended consequences, we should remind ourselves that a couple of hundred years ago, health problems in industrialising cities in England led to the Garden Cities movement. But now, in the 21st centuries, in many places where we've got this Anglo-Saxon model of urban planning, we now face new health problems from urban sprawl. The concept of feedback. Climate change is increasing the intensity of heat waves in many parts of the world, leading to increased demand for air conditioning, thereby increasing energy use and greenhouse gas emissions from climate control in homes and workplaces. At UNU, we use an approach to systems thinking called collaborative conceptual modelling, developed by Newell and Proust, and this has 6 steps. Firstly, what is the challenge? Understanding the challenge that we're grappling with. Secondly, what's the story? What's the history of the decision-making to lead us to where we are? The third step, can I see how you think? This is about thinking across disciplines, which is critical for effective action. And then the other 3 steps, which are about the dynamics of what's going on, what's driving system behaviour, where are these leverage points, and importantly, can we see with new eyes? Can we have new eyes on the problem and reflect on what we've learnt? And then if we come back to that first graphic from Tony McMichael, the many things at play when we think about relationships between urban transport, land use, health and well-being, and present this as a system diagram. This is the sorts of things that we find. In the centre here, the travel that we have to do in a city like Berlin, and that will lead to emissions in the city and will depend on the mix of fuels for those modes of transport. Will it be the fuel that I've got around my waistline here, or will it be a fuel that's a fossil-based fuel? Now, there's other types of emissions, as I mentioned, the greenhouse gas emissions through different timescales and different places affecting health and well-being. Notably, though, other health impacts, a couple illustrated here, the risk of travel-related injury, the opportunity for physical activity. So that's the right-hand side of this system diagram, and then over on the left is where we're thinking about what we might do. So we need to be thinking about transport policy and land use policy in an integrated way. We need to be thinking about the infrastructures that we provide that are relevant to transport and mobility, the distances between things in the city, but notably also we need to reflect on our attitudes, values and preferences and the promotions, incentives and subsidies, as Andy pointed out, that sometimes drive us in the wrong direction. So my final slide is a bit of a plug for a new global interdisciplinary program, Health and Wellbeing in the Changing Urban Environment Using Systems Approaches. And this is jointly sponsored by the International Council for Science, the Inter-Academy Partnership for Health, I mentioned before, and UN University. And you can see a link there to more information. It's hosted at the Chinese Academy of Science in the city of Xiamen, and I encourage you to find out more about that work and engage as best you can. Thanks very much.
Many thanks, Tony, for giving us a great overview. And I'm sure, are there any points of clarification to Tony before he leaves? Or indeed, anything I said at the beginning? Or can we move on? Yes, John.
Causal connections and so forth, there's an amazing amount of really important things there. How do we prioritize those things so that we can get a handle on them?
Sure, absolutely. And I think for a health audience, clearly thinking about burden of disease is very important. You know, when we're thinking about the sorts of investments that we might need to make, we're thinking about the economics of health in this context, then we have tools already that we can use. That said, as this program highlights, it's not just about health as I, as a doctor, might define it. We need to be thinking about well-being and that broader context from the way we live.
Okay, well, let's move on, because we'll come back to many of these issues later on. So let me now introduce Sam Myers, who's from the Harvard T.H. Chan School of Public Health and Director of the Planetary Health Alliance. He was a member of the Commission as well. So Sam, over to you.
All right, thank you, Andy. It's really wonderful to be here with all of you. I've never been to Berlin before. It's an absolutely beautiful city, so thank you for the opportunity to be here with all of you and for the warm welcome that you've given to me and the other members of the Planetary Health Alliance over the last few days. I'm going to end up reiterating some of the things that Andy said, but I think that this is a relatively new topic for some of you, and so maybe that's not so bad. And then I want to go into a little bit more detail about some very concrete examples that you can sort of sink your teeth into a little bit about what we're talking about from some of our research. So as Andy mentioned, we've defined in the Commission what planetary health means. And really the core proposition is that we all are receiving enormous health benefits from a stable set of biophysical conditions around the world, including our climate system, land use and land cover, biodiversity, coastal barrier systems, biogeochemical cycles, fisheries, and that those systems are now experiencing really profound and pervasive transformations, primarily as a result of human activity, and that transformation represents a quiet but nonetheless urgent public health challenge for all of us. Now, one of the challenges to this proposition is that, as Andy said, human health has actually been trending in almost the exactly opposite direction as the health of these natural systems. So Andy mentioned that health has been dramatically improving by most measures over the last several decades, at the same time that biodiversity is in decline, that resource constraints are becoming more serious, that climate change is accelerating. So how do we understand this paradox? How do we understand, if human health depends on natural systems, that it's actually been improving at the same time that we've been ratcheting up our degradation of those systems? And this is what we call the ecological paradox. And it's one that we addressed head on in this commissioned report. And we concluded that as a commission that we're deeply concerned that the explanation for this ecological paradox is straightforward and sobering, that we've been mortgaging the health of future generations to realize economic and development gains in the present. Essentially, we are trying to bring attention to an enormous issue of intergenerational equity, that essentially we are reaping the benefits of a pattern of fundamentally unsustainable resource use while we defer the costs of those practices to future generations. So just as over the last several decades we have started to recognize that there are very important social and cultural and political determinants of human health, planetary health posits that human health is also nested in a set of environmental conditions to which we've become adapted and which are now in a state of rapid flux, that we are fundamentally altering these biophysical environmental conditions that underpin just about every aspect of the global food production system, from agriculture to fisheries to livestock, that underpin our exposure to infectious diseases, as Andy was saying, even the habitability of some of the places that we live. And the consequences of that rapid transformation of these conditions are concerning, and the core premise of planetary health is that that transformation may drive a significant share of the global burden of disease over the coming century. So if we look at this with respect to a specific dimension of human health, for example, infectious disease, there's this sort of bewildering array of pathways, and every one of these arrows is actually substantiated by a rich research base. And the point here is not to take in all of that complexity, but to notice that our exposure to infectious disease is really being driven in some part by conditions like temperature and precipitation, land use and land cover, the species composition of biological communities, even agricultural practices, runoff and eutrophication are driving how we're exposed to infectious diseases. And a similar set of schematics can be shown for something like nutrition, that again, human nutrition, the quality and the quantity of the foods that we're producing is driven by a whole host of different environmental conditions which are now in flux. In fact, this is sort of a fascinating moment in human history, right, where global demand for food production is now rising more steeply than ever before in human history. At the very same time that we are transforming just about every environmental condition that underpins our food production system. So as Andy showed, we have this challenge of dramatically increasing supply at the same time that the conditions that we've adapted to over 10,000 years are rapidly changing. So that all may sound slightly abstract, and I thought what I would do is give you a few very, very quick case studies from our own research group to explain how we actually look at these questions and what we find. And so I'm going to talk very briefly about the impact of rising carbon dioxide on the nutritional value of the foods that we eat, on how pollinator declines, the decline of pollinator species like bees and other insects might affect health, and about land use management and biomass burning in Indonesia. So very quickly, there was an outstanding question as to whether rising CO2 actually alters the nutrient profile of staple food crops. Over the last 10 years, with agronomists around the world, we've been growing these different 6 species, actually 41 cultivars of these different food crops, under elevated CO2, under conditions around 550 parts per million, which is where we expect the world to be in the next 40 years or so. And what we found was that, yes, in fact, at those concentrations, we see really significant reductions in the iron, zinc, and protein content of many of these staple food crops. And when we go ahead and model how those changes in nutrient content would alter the global risk of, for example, zinc deficiency, given estimates of what people are eating around the world, we see these really large impacts on global risk of zinc deficiency of up to 200 million people pushed into new risk of zinc deficiency, in addition to those who already have zinc deficiency experiencing exacerbations of those deficiencies. And this is a paper that we published last summer in the Lancet. We are about to publish a paper in Environmental Health Perspectives looking at the CO2 impacts on protein intake. We have another manuscript we just submitted showing that around 1.4 million women of childbearing age and children under the age of 5 would be put at much higher risk of iron deficiency as a result of these CO2 changes. So the point here is just that these are not esoteric curiosities, but actually stand to have large impacts on global burden of disease. We also published a study last summer in the Lancet looking at how the declines of global pollinator species might impact human health. And essentially what we did was to estimate what people are eating in 152 countries around the world, the pollinator dependence of each one of those agricultural crops, and then we looked at how intake of both nutrients like vitamin A and folate, as well as food groups like fruits, vegetables, and nuts and seeds would change under different scenarios of pollination decline, and what the associated burdens of diseases of those dietary changes would be. And essentially what we found was that we would see really pretty significant impacts on things like micronutrient deficiency and infectious disease, particularly in parts of the developing world, but that we would see even larger impacts on the non-communicable diseases, things like heart disease and stroke and certain cancers, as a result of loss of fruits, vegetables, and nuts and seeds, which have a very prophylactic role in preventing those diseases, actually all over much of the developed world as well. The last story is one that I think Montira is going to speak a little bit more about. I don't know how many of you saw these headlines about 2 weeks ago, but we published a study after 5 years of modeling how land use decisions are affecting the probability of fires and how those fires are leading to particulate air pollution and the downwind health impacts of them in Indonesia. And we just published a study a couple weeks ago showing that around 100,000 deaths were probably attributable to the haze episode in 2015. So these are just a few examples. There are hundreds more, but the point is that in so many ways we are altering these environmental conditions at a scale that is now driving significant fractions of global burden of disease. Thank you.
Thanks, Sam, for a great overview, bringing us up to date on a number of key areas. Are there any points of clarification to Sam before we move on? Okay, let's move on then, thanks, Sam, to our next speaker, Montira Pongsiri, who's very much engaged. She's from the World Conservation Society and also now just moving to Cornell, I believe. And she's very much engaged in the kind of policy translation of this planetary science. So we're looking forward to hearing what she's got to say about how we can get research findings into policy and practice.
Thank you. Yes. Thank you, Andy. It's really a wonderful honor to be here in your company today and at this wonderful gathering. So thank you very much for the honor to join you. So, as Andy mentioned, and Sam and Tony before him, changes that we're making to the environment, particularly ecosystem degradation, can have adverse, unintended human health impacts. But unless these impacts are well characterized, as Sam mentioned, some very clear examples, unless these impacts are well characterized and quantified in actionable ways, they'll remain externalities, meaning that they won't be factored into decisions that we make about public health and natural resource use and management. So planetary health has to be more than academic. What's really exciting to me is that if planetary health science, that is the science demonstrating the range of critical relationships between the condition of natural systems and human health, if this science is produced proactively in the context of known policy gaps and policy priorities, then it has the potential to impact and improve decisions, policies, and practices on public health and natural resource use and management together. So the work of the Planetary Health Alliance and Planetary Health generally has an important science policy component where we're trying to engage in opportunities and case studies to demonstrate the value of applied planetary health science in terms of more informed policymaking and decision-making. So we're doing this by engaging in a range of activities involving awareness raising, for one, of planetary health among decision makers and policymakers. And through that kind of engagement, trying to learn from those decision makers and policymakers what are the very specific policy needs and priorities. What are the science needs to address those needs, particularly? We're also trying to identify decision support tools already in use that could be enhanced with scientific data on environmental change and human health relationships. We're also, importantly, trying to partner strategically with other groups who are also working to mobilize science into policymaking so that we can share best practices, to continue to develop and document the sharing of lessons learned and best practices on how we engage in science policy at that very special interface to learn what works, why, what doesn't work, why not, and really to get smarter together and to learn from each other. So let me give you two examples, one at the global level and then one at the national level, where we're trying to bring the science and policy together, particularly to mobilize planetary health science to inform better decisions, policies, and practice. So about 1 year ago, as the work of the Commission was nearing its end, a number of the commissioners, Andy, Tony, Alex Eza from the African Population Health Research Center, and myself, engaged with the UN Environment Program to begin to understand what are the policy needs, the very specific policy needs for science, planetary health science particularly, to help support the SDGs, the Science Sustainable Development Goals. This figure is taken from the Commission report, and it shows at the center those SDGs representing health and well-being are dependent on the SDGs supporting the enabling infrastructure for development. That's the middle ring. The health and well-being SDGs are also dependent on the SDGs supporting natural systems. That's the outer ring that's represented here. So one of the criticisms of the SDGs, as ambitious as they are, is that they lack a coherent overall vision. We think that planetary health provides that overall coherent framework for thinking about the SDGs in terms of how to plan for them and to implement them by setting health within the limits of environment and natural systems. So as we began the engagement with the UNEP to begin to understand where their policy needs and science, particularly planetary health science, could come together to help support country governments to address together health and natural systems, we began to ask questions about what are the priority linkages, environmental health linkages in the SDGs context. We began this engagement at the time that we did because we knew that the UNEP was planning to feature healthy people and healthy environments as a theme of its biannual assembly. So we took that opportunity to integrate that theme along with the planetary health science that we knew was ripe for action and for thinking about the policy implications and decision-making applications. So Andy, Tony, Alex Eza, myself, engaged through the UNEP process, through the Assembly and through country governments to begin to ask where do the policy needs and planetary health science that we knew were mature and ripe to act upon could come together. What could we do together as part of a long-term working relationship to support not only the planning but the implementation of the SDGs process? What we learned through that process and what we continue to learn is that UNEP, the UN Environment Program, needs very specific science policy tools to address natural systems and health together and to make the case for country governments to work across sectors, particularly health, planning, environment, and natural resources, together to support these SDGs in an integrated way, much more so than is done now. What they've told us they need are, number one, predictive modeling tools. They need methodologies for assessment and monitoring the SDGs at the country level, the national level. They need, where possible, the inclusion of economic figures, meaning the quantification of health impacts from environmental change, so that decision makers can prioritize SDGs and the issues that are of concern to them based on economic values. We know they also need for scientists and the science community to communicate how to address, or the opportunities to address, health and natural systems in an integrated way, and how those opportunities and the strategies that are evidence-based can pay off over the long term. They want these laid out in sector-specific ways, and the priority sectors for UNEP and the country governments that they support are air quality, water quality, and disaster resilience. So as a direct result of that engagement with UNEP from well over a year ago and up until now, the present day, we know that UNEP and WHO together, jointly, will be organizing and convening with the planetary health community sometime next year to discuss through a very focused dialogue how planetary health science can help inform each organization's priority activities. So that's an opportunity that we're very much looking forward to, again, to figure out how to translate science to policymaking to support the everyday, day-to-day work of both organizations to work more integratively. Second example I would like to highlight is a case study that Sam touched on at the end of his talk. This is related to landscape fires in Indonesia. As you know, landscape fires pose one of the greatest environmental health risks globally. These fires cause some 300,000 deaths per year. These are preventable deaths. Landscape fires in Indonesia are a common practice to clear land for agriculture, whether it's for pulp and paper, timber, palm oil. Now we have tools, thanks to a team led by Sam Myers at Harvard, along with a consortium of partners, including Columbia University. We have tools now that can integrate satellite data on fire emissions, weather patterns that track their geographic fate over space, what we know epidemiologically about the exposure of particulate matter, PM2.5, and the human health outcomes from that exposure to populations downwind of these fire events. So with this kind of tool, this integrative tool, we can now quantify the human health impacts of these fire events, of population centers downwind of those fires. So that enables us to now put a measure on the fire events and what it means in human health terms for these land use practices. A very common practice that happens every year, every season. So we've begun to engage with the government of Indonesia on this type of tool, this modeling tool, science-based modeling tool, to begin to discuss with them how that tool might help them address the fires that they know they have to confront now. So under a new administration, presidential administration, and a new agency that was set up under President Jokowi's office called the Peatlands Restoration Agency, we've begun to talk to them about the functionality of that science modeling tool. Again, linking fire emissions to their transport over space and what we know epidemiologically about the impacts of those fire emissions on human health. We've begun to talk to them about the functionality of the tool and the relevance of that tool to how it may be supportive of this agency's work to protect and restore peatlands in Indonesia, which they're charged with doing. They have a charge and a mission of protecting some 2 million hectares of peatland in Indonesia over the next 5 years. Where did they begin? How did they prioritize? We think that this tool might be able to help them do that by protecting selected peatlands, and where fires avoided in those protected areas avoid the greatest human health costs downwind to their own populations, Indonesian populations. So we've begun to have those discussions, and we'll plan to follow up having a much more focused discussion on how to refine and apply that type of modeling tool to support their very specific needs on policy scenarios they're considering now, whether it's selected peatlands protection or total peatlands protection in Indonesia, and then begin perhaps to take into account for the first time human health in terms of how they prioritize their peatlands restoration work. And then also to perhaps incorporate some of the economic figures of the costs and the human health gains from the work they're doing on an ongoing basis in terms of human health measures. So that's an ongoing process, again, happening at the national level with the government of Indonesia. So more to come on that. But what I'd like to leave you with now are some considerations, criteria, issues to consider as you, hopefully in cooperation and in partnership with us, think about how to engage at that science decision interface. How do we find the right policy partner? Do they have capacity? Do they have a clear understanding of what their needs are in terms of science, in terms of what their policy gaps and policy needs are? Are there enough available and robust data on science linking environmental change and human health in the country? Are there good, strong stakeholder relationships with that policy partner, with academic institutions, with civil society, with other NGOs that are pressing for demand for change because of the enormous pressure of some of these environmental changes to not only health but well-being, but livability? And also, as part of the science policy engagement, are we addressing equity? Are we addressing some of the environmental justice considerations? As we've heard, environmental change increases inequities. Are we addressing issues that affect the most vulnerable at-risk populations? Not only the poor, but also the next generation that will inherit some of these problems. And then lastly, transferability. Our engagements and our approaches in addressing science to policy and science to decision-making, are they transferable or generalizable to other areas that are experiencing similar environmental changes over time? Thank you very much. Look forward to the discussion.
Many thanks, Montira, for giving us really such a great overview of the kind of issues and challenges involved in engaging with policymakers nationally and globally. Our last speaker is Robert Seabag. As I said earlier, it's going to be absolutely vital to engage the private sector if we're to make any progress on planetary health and to really develop new business models which take into account both the need to adapt to environmental change that we can't prevent, but also to reduce, to mitigate these dramatic environmental trends that we're observing. So it was a great pleasure to introduce Dr. Seabag.
Thank you very much. No, I have no slide. You can look after me, no problem. Sorry. No, thank you very much. Two things. First, I thank you very much, and I thank the World Health Summit to invite me. And I was in the first World Health Summit 8 years ago, and I think it's always a very holistic approach. And I'm very happy to tackle climate change, but to tackle migration. And we'll see how climate change, migration, when you have an holistic approach, it's the same problem. I am responsible for a department at Sanofi, access to medicine, but I am also an infectiologist, still working in hospital. And I will try to tell you why a private company involved on health, they want to tackle this problem of consequences on health and climate change. And also I want to say something. You said something, Andrew, about the COP21 1 year ago in Paris. I think it was a very big diplomatic victory, but a failure in terms of how to attract the civil society. And one of my explanations, I think if you don't explain to the civil society the risk of climate change with something very concrete, and health is concrete. If you say to the people with climate change, you will have this type of disease, you will have dengue because before it was only in developing countries. I will give you some example. They don't really be very favorable. See, very far away about their daily activity. It's why I think to put health and climate change, the consequences, I think it's a very important one. And as a company, health, I told you, we have to see the risk. And I'm sorry I will give you a list of risks. I hope it will be only a risk. But it's very important to give the risk and after to be prepared to tackle the risk. But also, as a company, we produce, we have some manufacturing sites, and we have also a greenhouse gas emission footprint. It's why we have to see also the mitigation. I'm not a specialist on mitigation. At the end, I will give you some example. But the first I want to come back about health. First, some risk. Vector-borne disease. I will give you a list. Malaria, dengue, Zika, chikungunya, Lyme, I can add Chagas, I can add Leishmaniasis. If you take malaria, for example, you know that the vector of malaria is the Anopheles. Anopheles, the woman of Anopheles. And above 2,500 meters can live. But you have some country now with warming. You take Bolivia, you take Ecuador, you take Peru, you take some high country in Africa around Ethiopia, the risk of malaria will appear. And I think we have to be prepared. And we have already some cases. If you take dengue, chikungunya, Zika, same vector. Aedes aegypti, Aedes albopictus. Now, in France, if I take about my country, the example, but in Italy, in many countries, we have the vector. We have the vector. In my department in hospital, we have received 2 autochthonous cases of dengue, not travelers, in France. Zika, we have in Martinique, Guadeloupe, but it's big migration of population. The world is one. I received 4 cases of Zika in Paris. If the vector is in France, it's a risk of propagation. And we have seen in Brazil, we have seen Central America, coming from Africa, movement of population and big increase of Zika in Brazil. If you take Lyme disease, and I know in the United States, in many areas, in the forest, they say warning about Lyme disease. With the increase of hot season, you have much more tick. The tick is transmitted the Borrelia, the germs responsible for Lyme. And in France, I can tell you, we have seen a big amount of Lyme disease. People coming from Lyme disease. I can tell you about Leishmaniasis, about Chagas. When I was a medical student, they told me Chagas is only Latin America. Now you have cases of Chagas in the south of the United States, in Florida, because the triatoma, the vector of Chagas, is present in some country. We had 1 case of Chagas in Australia, even 1 in Japan. Just 1. But we have to know and to be aware if we want to attract the population and to find some solution. We speak a lot, my colleagues, about respiratory disease. Big increase of asthma. Big increase of allergy. With a change in terms of biodiversity, new plants, old plants, and you have big increase of allergical disease, but the pollution is a very important one. And after, sorry for this list, you have disease linked to water and sanitation, cholera. I don't know if the last hurricane in Haiti is linked to climate change, but it was so strong. What we have seen in Haiti now, new outbreak of cholera. If you take Bangladesh, the delta in Bangladesh, the delta in Vietnam, Mekong delta in Vietnam, now you have with the sea level, the increase of the sea level, you have a salinity. The Mekong delta in Vietnam is production of rice, not only for the country, but also the exportation for the country. And you told us it's a vicious circle. When you touch something, and you want to study consequences on health, it's many things, and my colleagues speak about zinc deficiency. I will say a few words on this type of thing. But it's very important. You know that, for example, in Bangladesh, when you have flood in the delta, the snake bites. Because the snake, when you have a lot of water, they're coming out, and you have a lot increase of snake bites in Bangladesh, and also it's a case of deaf people. Nutrition, you speak a lot about nutrition, linked to flood, but linked also to drought. But I want to point and really to raise on one topic, migration. But with migration, give you one example, tuberculosis. You say, why migration and tuberculosis? Because you are perhaps not specialists on infectious disease, but when we speak about TB, you have 2 types of TB. You have active TB, infection, you are sick, fever, you cough, and you need a treatment. But you have latent infection TB. Latent infection, you have the germs within your body, you are not sick, you are not contagious, but in case of some change, you will go from latent TB to active TB. You know that according to WHO, 2 billion people are latent TB. Perhaps you, myself, I don't know. There's no risk. But in case of decrease of your immune system, you will go from latent TB to active TB. Zinc deficiency, we know very well when you have a zinc deficiency, you decrease your immune system. And when you decrease your immune system, you can go from latent TB to active TB. Migrants, why migrants? Because migrants, it changes behavior, it changes climate. You imagine the stress, and I speak in a country and in Europe, we have a lot of migrants. And we have seen in Paris, in some study, increase of TB with migrant people. And this point is very important. And now migration, many communication here, 3 types of migration. Okay, political migration we have seen from Middle East, economical migration from Africa, for many reasons linked to climate change. But the third one, climate migration. We have a lot, and it was a very nice publication made with partnership between Virchow and Villermé with Charité, climate migration and health. Very, very important topic. And I think we have to tackle this type of topic in many countries. In many countries, we have to know. When you know, we try to find some solution. And this point is something very important. And when I speak about latent TB, you have risky population, co-infection, people with HIV, decrease of immune system with TNF treatment, prisoners, and migrant. It's a very important one. And the last one, because they speak a lot about the migrants today, mental health. Okay, mental health for migrants, but if I link mental health and climate change, we don't know when, but we know some countries, perhaps, with the rise of sea level, perhaps will disappear. Marshall Island, Vanuatu. If you go in Maldives, not the big hotel, nice hotel in Maldives, if you have been in the capital of Malé, the capital of Maldives, is a big circle, sea level. And I know that in the level of the government, they think, what could be probably within 5, 10, 15, 20 years if we disappear a million of people? Marshall Island is a case. Vanuatu is a case. They think about that. You imagine the population, the anxiety. This is their country, and perhaps they say, one day, perhaps my country will disappear. You imagine how you induce some anxiety, some depression, some mental health problem. And I think we have to think about that. Yes, I finish, promise. No, just to tell you, as a health company, Sanofi, we have to tackle, we have some solution for dengue, we work for Zika vaccine, we work for respiratory disease, for malaria. But it's common partnership. We have to build this type of thing. And in terms of mitigation, we have to know exactly what is the production of greenhouse gas, our footprint. For just one example, all the production for a multinational Sanofi before was by plane. Now everything is made by boat. We reduce for 85% the transportation by plane, and many other things, the consumption of water, and so on. And I think thank you first to invite, and I think all together, it's not private, public, and academia, all together we have to tackle this problem, and thank you to put health is the main problem of climate change. Thank you very much.
Well, that's a great overview, I think, of how the private sector can very imaginatively tackle the issues of environmental change. Any points of clarification to Dr. Seebag before we have a more general discussion? Could I invite the other panellists to come and sit at the front? Perhaps we'll launch straight into the general discussion then at this stage. Is there, oh, sorry, one question at the front. Microphone? Yeah.
Thank you very much for all speakers. My name is Rashid Khaldoun. I'm a medical doctor doing a master in health management in Austria, MCI University. I would like just to say that what Dr. Seebag said, that we need to talk about mobility. The global mobility is a real priority now in research and in literature. And according to Planetary Health, it's probably, I think, the unwritten topic you don't find anything about migration. It's not just about, there is different kind of migration. We need also to take into consideration return migrant, because it's like cycle phases. And maybe my question, is there any plan to start drafting or framing a new policies connecting the climate change or change and or planetary health and global mobility? Thank you very much.
I told you about I was a little disappointed by the COP21 if it was really a very important diplomatic victory, but not enough about health. And I hope for Morocco now, the COP22, the COP22 now in Morocco within 1 month, I hope they will put health, because there are means to reduce footprint, CO2 footprint in the world, but they have to think about health. And I think it's very important, and people in charge and in terms of research, to put the finger about the risk of health. Because if you want to attract people, because we have to change our behavior, and this is the responsibility of each citizen in the world, we have to know exactly the risk. And if you say, my children is as a risk perhaps to contract dengue, Zika, or something like that, or respiratory disease, perhaps we will really adopt a sort of change of behavior.
Thank you. So, Sam, did you want to add anything about the migration issue?
Just to agree that, I mean, it's absolutely critical. And I don't think that it's restricted to climate change. I think it's climate change in the context of a whole variety of other kinds of environmental change, so that the combination of deforestation, or the combination of sea level rise associated with climate change, with the loss of coastal barrier systems like mangroves and vegetated dunes and wetlands, creates a lot more vulnerability for coastal populations. And so, you know, it's an enormous issue. It's not one that we've been able to grapple very well. It's very complex, and it's an area we really need to do more research, because it's probably going to drive, along with food insecurity, a significant burden of disease in the future.
No, I think that's a very important question, and I think it is coming to the forefront of the research agenda. Although the biomedical research funding community has not really put enough money into this area, it is beginning to change. We've seen the Wellcome Trust putting substantial amounts of money into research on what we might call planetary health, will encompass some migration issues. We're doing some work at the moment on thermal stress, because we think that's an under-recognized problem, that in many parts of the world, as the temperature goes up, it becomes more and more difficult to work outdoors. More and more people are pushed into poverty. We already know of some data in a country like Pakistan, for example, where people are beginning to migrate from the rural areas to the urban areas because they can't work during the summer months. So the only way they can keep the money for their, earn the money for their families is to migrate to the urban areas in search of different kind of work. So it is beginning to happen, but as you say, it's complex. We haven't, we don't understand all the linkages, and it's really a priority for research. So let's have some other questions. Yeah, please. Would you like to go to the mic?
Hello, thank you very much. My name is Julius Murke. I'm from the organization Young Leaders for Health. I have two questions. One to Mrs. Pongsiri on the translation of science to policy. When you decide on policies, it's a lot about cost effectiveness. But my question would be, how do you actually translate an effect in one sector to an effect in another, and how do you compare them? I mean, you could try to translate maybe an effect on health or climate to a quantitative measurement of money, to a monetary measurement, but maybe as commissions such as the one chaired by Josef Stieglitz and Amartya Sen showed, this is maybe not the way to go. So I would ask you, how do you act on it and what alternatives there are? And another question goes to the whole of the panel, maybe I don't know who can answer it, but I would be very interested in what you think about the impact of the new urban agenda on planetary health. The agenda being passed in a few days in Quito on urban development, and maybe how we can use this agenda in order to foster planetary health. Thank you very much.
Thank you. So, Montero.
Thank you for the question. It's an important one. So when we think about science to policy translation or application, we usually talk about it in terms of dialogue and working in partnership with the policy community. And that means a very transactional, very costly use of time and resources to engage and build those relationships, because we always have to try to frame based on the science that we know is strong and robust in the ways that we know the policy community needs and, more importantly, can use and apply. So, for example, in the SDGs context, when we first began to engage at the global level, but again, it's at the level of the countries, because organizations like UNEP and WHO are supporting countries at the national level to monitor and assess progress on the SDGs. So we have to assess first, as we dialogue with them, what are their capacities to actually absorb some of the science that we think is ready to be used? Do they have a clear understanding of this, what we would call the science to decision pathway? How would they use the scientific knowledge and learning to inform an ongoing dynamic decision process? So, for example, we're exploring right now an engagement with the government of Cambodia at the provincial level, and this is key because the provincial level government is very concerned about the impacts of infrastructure projects. These decisions are made at the central level that are considered to be net positive for the entire country. At the provincial level, there are concerns that the impacts might be differentially adverse. Impacts to fisheries and human nutrition based on their dependence on fisheries. So in that case, where the provincial level actually sought out science because they wanted to understand better the big picture of risks of these infrastructure projects that are decided upon at the central level, they really want to understand what are the links, the interactions, the feedbacks between economically driven decisions, natural resources issues that they care about, and health and well-being. So that dialogue and that engagement on science policy was initiated by policymakers, not by us. We then engaged, and we're in the process of engaging, to describe and share some of the science that we know is available at that spatial scale to see how it could be informative of some of the systems modeling tools that are in use. Again, these are predictive modeling tools to help governments to make decisions based on different scenarios, decision scenarios they're considering now. So again, it's always very context specific at the appropriate geographical scale and based on what the policymaker needs and what they know they can do with the science to inform their own ongoing policy process. And that's very much sector specific. Sometimes governments are looking for science and evidence to justify and strengthen the case for them working across sectors within their own government. They don't have some of that evidence sometimes. So we've been asked for that type of evidence for integration, not only in the SDGs context, but in other contexts, whether it's landscape fires or infrastructure on the dam, on the river, on the Mekong. So I'm happy to talk to you afterwards.
Okay. Just 2 points about the policy engagement. One is that the timescale of many policymakers is very short, and we in the research community and this agenda is thinking about a long timescale. So what's really important is to develop arguments around the near-term co-benefits to policymakers. It may be health, it may be other factors as well. And one technique that's being increasingly used is multi-criteria decision analysis, because most policymakers wouldn't make a decision on a single criterion. They would look at a whole range of issues like employment opportunities, reduction in traffic congestion, if you're a city mayor, for example, and health would just be one of them, maybe agricultural productivity. So building decision tools that can reflect outcomes that are across different sectors is, I think, a really useful way of making these things transparent and really articulating where the near-term benefits might be to policymakers is also an important strategy, I think, for productive engagement with them. Now, does any of the other panelists want to talk about the new urban agenda or the UN Habitat? Or okay, well, yes, Robert?
Perhaps one positive point, if let me. When I say world is one, and I gave you a list of some diseases before were only in developing countries. Now we have the risk, a global one, developing, emerging and developed country. This is only the positive point, perhaps, to push the richest country to invest, research, for this, because they will touch everybody. We have a sort of strong solidarity in front of this type of disease because it will touch all the world. Why suddenly the US governments have decided to put a lot of money on Zika? Because they are very afraid. They have Zika in the borders. They have some case of Zika in the United States. They have decided to finance research for Zika, and I can give you many other examples. I think it's a positive adverse event about consequences on health and climate change.
Thank you. Just to say a few words about the urbanization agenda, I mean, I think this will be very much centre stage in Quito at the UN Habitat discussions. I think it has been, frankly, quite disappointing to see that health has not been given a higher priority or higher profile in the whole run-up to the UN Habitat conference. And certainly I know a number of people have been trying to make this case. So I do think we need to keep pushing on this agenda, and I think some of the presentations we've had this afternoon have shown how urban development is inextricably linked to human health. And so I really believe it's important to keep making those cases that, you know, investments in transport sector, for example, housing, energy, urban food systems and so on will have very profound impacts on the planet, but also on the health of urban populations. So maybe not reflected as much as we would like to see right now, but I think there's still opportunities to push that forward. And one of the, I think, great opportunities is through some of the city networks. So, for example, the C40 network, which brings together many of the big urban centres around the world, is expanding its remit, but it's also beginning to look at this health co-benefits agenda. How can we achieve benefits at the same time as reducing environmental impact? So I think working with these city networks like C40, ICLE and others is probably the big opportunity for the future. Questions? Yes, please, at the front. Yeah, please.
My name is Aline Philibert. I am from the University of Quebec in Montreal, a Centre Virchow-Villermé à Paris. So I would like to thank all the speakers. So I've got 2 points I would like to mention. So my background is ecosystemic health. I've done it with IDRC in Canada. Probably you know this research center at the not at the university, at the Ministry of Canada. So 2 points. For me, ecosystemic health, let's say planetary health, is based on 6 pillars. So we talk a bit about them. So it's about transdisciplinary. We talk about it on Sunday, I'm sorry. It's about gender and social equity. It's also about participative approach, system thinking, we talk about today, knowledge to action, and sustainability. There are 2 points I think we missed since yesterday. From my point of view, it's participative approach. Like, say, we have to talk with stakeholders, but stakeholders, scientists, people, communities, individuals, and not only policymakers and scientists and people at the top level. We have to think transversal way and not vertical way. And as well, we didn't talk too much about gender and social equity. When we work in ecosystemic health, we need to take care of it, I think. So it's something, if you want to comment. My second point, it's more of a question. I would like to address some challenges I faced and still face. It's about, the strengths of planetary health is to explore the interrelationship between health and the status of environment and all other factors, okay? But at the same time, while the strength is this interaction, the weakness is to gather data. We don't have many data of diverse fields and at different scales as well. So while we know that science, the mainstay of excellence in science is based on quality of data. If you've got data, you are able to produce knowledge, to provide recommendation, and to get money from funding agency to go forward and to implement your action. So how do you do that? Because do you think, so it's my question.
Okay, we have to finish now. So
iterative process of learning, like a predictive model, integrative framework, could be a solution, like iterative learning process, because it has to evolve over time depending on the stakeholders.
Okay, let's try to answer some of those issues. So, Montero, did you want to start?
Thank you for raising the point about inclusivity and participatory approaches. Because certainly in the science to policy work that we do, we recognize that's a very important feature of the process of engagement, because not only does it engaging with whether it's civil society or communities, it not only makes the outcome better and the process more informed in terms of the vision that people want for their communities and the long-term sustainability goals that they envision they want to achieve, but it also builds social capital, right? And you need partners within the community because they're the ones who will carry out and sustain, in the end, the science and knowledge in terms of reception and to apply it to inform what they need and to ensure their values are met. So that social capital that comes as part of the inclusivity and the process by which you engage and build, whether it's systems modeling tools for the community to use, is very, very important. So thank you for bringing that up.
Okay, should we round up final comments, maybe in response, or any other comments you want to make?
Sure. Just in terms of the point, as far as I understood it at the end about access to data, I do think that that's actually a pretty critical precept for this sort of emerging interdisciplinary field of planetary health. The kinds of problems that we're trying to understand, whether they're issues of migration or complex issues of land use change and exposure to infectious disease or food security, involve lots of disciplines, lots of data, and often it's hard, particularly for young investigators, to get access to that data. And so that's one of the things we're trying to do with the Planetary Health Alliance, is actually help provide that access. I know that also the Future Earth effort that Andy's taking a really central lead on, and the Knowledge to Action Network is also trying to provide that access. And so we hope that there will be avenues developing very rapidly for young investigators to identify really rich data sources in both the environmental sciences and the health sciences and the social sciences, to begin to start to weave these data sources together to come up with new kinds of analyses. We've just published an entire database on what we think the world is eating and made it open access on the Planetary Health Alliance website, and we're hoping that that will be a trend. So I do think that's a very important issue going forward.
Robert? Okay. Well, let me just quickly respond. I mean, just to endorse what Sam has said about data, I totally agree it's really crucial. And Future Earth, as he mentioned, is a global collaboration of environmental scientists, and they are building, they want to build a health component, a health network within that broad interdisciplinary collaboration. So one of the priorities for that will be to map out the source of environmental data and health data and discuss how these might be linked either through a portal or through a variety of websites. So it's absolutely crucial, as you say. Transdisciplinarity is, I think, for many of us a new departure, because many of us were brought up in a kind of rather narrow disciplinary perspective. But certainly we in my own institution, I think increasingly in others, we're beginning to look much more broadly for collaboration. So the kind of people we're working with now are climate change modelers, agricultural scientists. Our most recent appointment has been a soil scientist, which we've never had in the School of Public Health before. Obviously water engineers, anthropologists, people who understand, culture and so on. So it's really a much more, obviously there has to be mutual respect, and we have to try to learn the language of different disciplines in order to maximize the potential of these partnerships. But I think we are really entering in a very exciting new era for public health by actually broadening out of our institutional and disciplinary boundaries and working with people from a whole range of backgrounds that a few years ago we wouldn't have thought of working with. So I'd like to end on that very positive note to thank you all for your contributions, to thank the panelists, and we're very happy to stay behind and speak if you're interested in doing so. Thank you.